Hello everyone, welcome to Texture Myth. In this session, we are going to talk about another very important topic related to medical coding, anatomy and physiology, that is anatomical position. So here we will discuss what is anatomical position, why it is important to learn, and also we'll discuss about some of the common errors that are that should be avoided while preparing the anatomical description. Okay, so these all things we are going to discuss in this session in detail, and at the end of the session I'll also provide you the question that you can answer in order to learn the concepts faster and also to help the others. Okay, because when you will be answering those questions, you are also helping others, so I strongly recommend you to answer those questions. Okay, so as I mentioned, like we will proceed in the same way. Firstly, I'll explain you the things in a very simple terms. I'll also show you the notes which I have prepared for you, so you can just simply refer it, and you can also take a copy of it maybe through notes that you can refer it later. Okay, but before we proceed further with this session, I would like to recommend you to please go and check out the previously released session first, because they all are in proper sequence and sync. So if you follow it sequentially, then it would be much more easier for you to understand the ongoing topic. Okay, and just to make the things easier for you, I have already attached the Texture Myth digital course books in the description box, which is free for all of you, and there you will find thousands of video on other programming as well as medical coding related concepts, and those sessions are available in both Hindi as well as English language. So you can just simply find the tab for medical coding in that book, and from there you can refer the content. Okay, alright, so let's get started. So firstly we will be talking about the anatomical position definition, because before any topic we should know about the definition at least, right? So here you can see I have prepared a very simple notes for you. So let's see what is the definition. The anatomical position is the standard reference posture of the human body used in anatomy to describe the location, orientation and relationship of the body part. So this is very important and very simple definition, because it is clearly mentioning that anatomical position is a standard reference posture of a human body that is used in anatomy to describe the location, orientation and the relationship of the body parts. Clear? Now second thing is very important. All anatomical position or description are made with the assumption that the body is anatomical position. Okay, so whatever description are provided as a anatomical description by the healthcare professional expert, they always assume that the body is in the anatomical position, okay, regardless of the actual posture of the body. Okay, so they are not considering the actual posture of the body, they are assuming that the body is in a anatomical position. Clear? Now here I have noted down some of the description related to the anatomical position. So in anatomical position, the human body is characterized by the following features. Okay, so these are some features that I have noted down, and for anatomical position, in a anatomical position, the human body is characterized with these features. So let's see what all features are there. The first point says the body is standing erect and upright. Okay, so for anatomical position, the body is standing erect and upright. The head is level and the eyes are directed forward. Okay, so this is also very important point. The upper limbs hang freely at the sides of the body. The palm of the hands face anteriorly forward. Next is the thumbs point laterally away from the body. Then we have lower limbs. So the lower limbs are straight, the feet are flat on the ground and the toes point forward. So these are some you can say the features when we are talking about the anatomical position. Now somewhere we know what is the definition of anatomical position. Now let's try to understand some of the key reference principle. Okay, so here I have noted down very important point. The right and left side of the body are always described from the subject's point of view, not from the observer point of view. Okay, so why it is important? Because while preparing the anatomical description, if you are considering left and right side differently, then it will totally impact your report, right? That's why it is always fixed that right and left side of the body are always described from the subject's point of view, not from the observer's point of view. Here, next we have importance of anatomical position. The anatomical position is essential because it provides a universal reference standard. So now you know that if we have any standard document to follow, then everyone can follow and refer the same thing. Otherwise, what will happen? Every team will consider their own standard, and in that case there would be a lot of confusion, because some people are considering thumb forward, some are considering palms forward, inward, some are considering palm outward, right? So that is not a correct way. That's why we follow a universal reference standard, and this is possible because of the anatomical position. Second thing, it ensures clear and precise communication among the healthcare professional. Yes, this is also very important point, that it clearly provide the communication in a very simple terms. Then we have prevent confusion in describing the location and movement of the structure. So if you are following the proper standard of anatomical position, then there is no confusion in describing the location and the movement of the structure. Next point says forms the basis for. Now the anatomical position forms the basis for anatomical terminology, right? Through which through these anatomical position we decide the anatomical terminology, directional term, surface anatomy, clinical examination, and radiology interpretation, and also the surgical procedure. So for all these areas it forms the basis, which anatomical position forms the basis for anatomical terminology, directional term, surface anatomy, clinical examination, radiology interpretation, and surgical procedures. Clear? So I think now we have idea what is anatomical position, what are the key reference principle, and the importance of anatomical position. Now we'll talk bit about the differences. Okay, so for the three features, that is palm, thumb, and purpose, we will try to see the difference between the anatomical position and normal standing position. Okay, so palm. So in case of anatomical position, the palm is facing forward. On the other hand, when we talk about the normal standing condition, then the palms are facing toward the body. Okay. Similarly, if we talk about the thumbs, the thumbs are pointing laterally, but in case of normal standing, thumbs are pointing medially. If you don't know what is laterally and medially, don't worry. In the upcoming session, we will talk about these things in detail. But for now, just consider it that it is pointing laterally and medially. Then, if we talk about the purpose of this thing, so anatomical position is for scientific reference, and normal standing is just a normal posture. Clear? So this part is clear. Now, next thing is the related body position. So supine position, the body is lying horizontally on the back, face directed upward. Prone position means the body is lying horizontally on the abdomen, face directed downward. So these are the two related body position that we consider. Here. Now next we will talk bit about the common errors that should be avoided. The first thing is describing structure without assuming the anatomical position. So if let's say if someone describe the structure without assuming the anatomical position, then that is a wrong. That is not a right approach. Why? Because it will change the entire description. Okay, so always make sure to describe the structure by assuming the anatomical position. Second thing to avoid is confusing observer right with the subject right. So don't get confused between the observer right and subject right. Okay. Third thing is incorrect hand orientation. So always consider the correct hand orientation, which is palm facing inward. Otherwise, what will happen? It will cause issues. Okay, like you can see here I clearly mention So let me show you. Yeah, here you can see the palm of the hand face anteriorly forward, okay, not inward. So if we consider it wrong, so the entire report will be prepared in a wrong way. Okay, now we have some examination oriented points, like anatomical position is a reference position for all anatomical description. That is true. Directional terms such as anterior, posterior, medial, lateral, proximal and distal are the defined based on the anatomical position. So these all directional term is also depend on the anatomical position. Clear? Now if we summarize the entire session, so we can clearly say that anatomical position is fixed for reference posture. It is standardized the description of the human body. It is fundamental to the anatomy, physiology, radiology and clinical medicine. Clear? So I hope today's session is clear. Now I have one question for all of you, and today's question is, what is the highest level of organization in the human body? I'm sure you already know about the answer of this question. So if you know the answer, I request you to please do share your knowledge in the comment section so that others can take a reference from your answer. In case if you don't know the answer, it's completely fine. You can refer the previous early release session first, because there I have already explained this question. And once you understand the meaning of this, once you got the answer for this question, then please do share your knowledge in the comment section so that it would be easier for others. So yeah, that's all for today. See you in the next session with new topics. So thank you for watching TechShare Myth.